Hi, I'm Dr. Eugene Nowak, founder of Nowak Aesthetics. Welcome to my office. Let Nowak Aesthetics show you what the most innovative procedures in dermatology, cosmetic surgery, and skin rejuvenation can do for you. Look younger, feel better, get curves in all the right places. At Nowak Aesthetics, we'll show you the way to a better you. Call for a free cosmetic consultation. 619-420-1840. Nowak Aesthetics. We're conveniently located in Eastlake. Let us help you be you.
Only better.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering liposuction. A brand new technique, fairly new, lipo. If you have unwanted fat that is not responding to diet and exercise, my advice, stick around for the latest edition of The Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering liposuction. My first guest is Dr. Eugene Nowak. Dr. Nowak, welcome to the program.
Thank you, Randy. Thank you for having me.
Now, liposuction, hot topic, and you do a lot of it.
Lipo is what we specialize in.
Okay.
And it is an amazing procedure. It's come so far in really the short time, the last few years, have really made some big steps towards getting people better results, faster results, safer results. And it's nice because they see the results very quickly.
Okay, now you're doing what's called thermal lipo, and that's fairly new.
Thermal lipo is new.
You're the first guy to do it in San Diego?
We're the first office to do it in San Diego, and it's really taken two procedures. It's taken the safety of a tumescent liposculpture procedure, and we're adding the skin tightening of a thermage. Thermage is a radio frequency. It heats and tightens the collagen support network of the skin. Combining the two, we can get more tightening for people, get them a smoother result, get them a quicker result, and make a big difference for them.
Now, why is it you like lipo? I ask you that because we've done hundreds and hundreds of shows now, well over 800 episodes, and I think I've met two, and I told you this, about two other doctors that like liposuction. Why do you like it? They say it's tedious.
Well, it's definitely tedious. It's definitely a physical procedure, but the results are amazing. And it's really, you can't replace these results with anything.
So the happy patients.
Oh, absolutely.
Okay.
The people coming in, when they look at their picture and they say, "Are you sure that's me before?" Because I don't remember looking like that.
Do they really say that?
They absolutely do. Absolutely say that. And we tell them up front that they're going to say that, and many of them say, "Oh no, I'll remember." But you get about 6 weeks. The pictures, we like to take pictures about 6 weeks afterwards. They've healed enough to where we can see the difference, but they're starting to forget how they actually looked.
Okay, liposuction, is it still the most popular procedure of all cosmetic procedures?
Of all cosmetic procedures, it's still number one. And it's still growing by leaps and bounds. Women by far are the main treatment area, but men are also coming in for the procedure.
Are they far? And what is it, about 50 or 70% women? And
it's probably about 85–90% women, and it's probably about 15% men.
So what's changed over the years with liposuction? We've talked off camera. You say it's safer today than ever. How so?
It really all came about with the tumescent procedure. The tumescent liposculpture, it takes away general anesthesia, it takes away the sedation, the risks that are associated with that. The people literally come in, they get some medication to relax them. The rest is done with local numbing medicine. So the patient's actually awake and alert. They're talking to us. So they're not out? They're not out.
Okay.
They're there talking to us during the procedure. We ask them to move and turn. They're able to do that. They're up and they walk out of there under their own power. So
who is the typical patient that comes in for liposuction?
The typical patient, it's really a broad spectrum. The procedure is opened up to so many different people. It's anywhere from people that are having a reunion, they have a wedding coming up, someone that just wants more shape and contour. Classically you have a mother who, with the trauma of pregnancy, has lost some of that shape and contour, wants to regain some of that. We have people that are active. We have people in the military that work out every day but have lost that shape and contour, find that they're just not able to lose weight as quickly as they used to be. And we're able to make a big difference for them. Men, like I said, come in, they want the little love handles taken down a little bit, or they want to work on the chest, or don't feel comfortable. We have people that don't feel comfortable wearing clothes that fit tight, that have shape and contour that's hiding there, but it needs to come out.
Okay, what areas of the body are you doing liposuction? I mean, what's the #1 area?
Well, the #1 area would be across the midsection, and we really try to do as much as we can to make a big difference for the patient. So we would include the abdominal area, get into the waist and the lower back area. We'll try to come up and taper into the little bra fold area. And that's really probably, a big concern for women. And we want to get into that some, but we really want to take more from the waist. We really want to bring them in, bring down that shape and contour, bring bring out what they have hiding underneath there.
Okay, arms, I mean, I guess any place that has unwanted fat.
As we tell people, what you can pinch is what we can take down a good portion of that. You know, the midsection would be number one. Arms and legs would be probably the number 2 area. After that, people might come in and say they want to work on the neck area.
Knees? I mean, do you ever do knees?
Absolutely.
Is
Absolutely.
that right?
So we try to contour from the inner thigh right down to the knee to try to bring that down to get as straight and smooth of a contour as we can.
Is it true that you're getting a fitter group of patients that are coming in for liposuction?
Yes, I mean, definitely, you know, we have anywhere from the people, I've had marathon runners come in and they just have areas that are stubborn, even though they're in great shape.
Even on a marathon runner?
Even on a marathon runner,
okay.
They're in great shape, but they have certain areas that are stubborn, and sometimes it's a genetic, hereditary thing.
Like a little saddlebag area?
They'll say everyone in my family has that, even though I'm in, you know, the lowest weight I can get, I can't lose this. Anywhere to that, like I said, someone that's just had a couple children and is looking to regain that shape and contour.
Okay, now what about the upper range, age range of patients getting liposuction that you see?
Well, it really depends on the health of a person, and we do a pretty thorough health history, do extensive blood work to make sure they're the healthy person that they appear to be. The safety, like I said, we're not putting them under general anesthetic, so that we do have some people that couldn't undergo that procedure that can have this. But in general,
50s? I mean, people in the 50s, 60s getting liposuction?
Even into the 60s,
okay.
Absolutely.
Will the skin bounce back?
The skin is actually very elastic, and it's really a combination. The lipo procedure takes the fat or the weight off that area so we can bring that skin up, and it can shrink a lot. In addition, someone has stretch marks, has wrinkling or rippling in the skin, we add something like the thermal lipo, adding the thermage to get us some of that skin tightening on top of that, and their skin will actually tighten for up to 6 months after a procedure.
Okay, now I know you brought a lot of photos, and we'll get to those in a second, but help me understand. I guess the hot topic is thermal lipo. What is it? How does it work? How are you using it?
So thermal lipo is really a combination of 2 different procedures. It's taken a tumescent liposculpture procedure to give people shape and contour. But if they have concern about the condition
what is
of their
tumescent?
skin,
I mean, help me understand that.
Tumescent procedure, it's local anesthetic. So the patient takes something to relax them, but the areas that we work in is just a local numbing medicine, kind of like you would go in for a dental procedure, but it's just infiltrated underneath the skin to fill the layer. It constricts the blood vessels, so there's little or no blood loss with the procedure.
Okay.
The patient's awake and alert, but they're comfortable. They're not feeling
So
anything
tumescent
more.
was the new thing, I guess not so long ago. And now the next level is?
The next level is thermal lipo.
Thermal lipo.
Yeah, because before that we relied on the patient's skin and the ability for
So this
it
is
to
not an
contract.
injection we're talking about. I mean, this is standard lipo, but...
This is liposculpture. This isn't lipo-dissolve. This isn't where we're injecting a medication to try to melt the fat. This is where we're actually removing the fat cells.
You're removing the fat, okay.
We are removing the fat cells. Once we've removed the fat cells from that area, the fat cells are not going to come back to that area. So if people are going to gain weight, they could gain weight in other areas, but we've removed the fat cells.
So this thermal lipo, the thermal is the thermage?
That's the thermage.
Portion of it. And what does it do? I mean, what's the mechanism that
Thermage
helps
is
with the fat
skin
loss?
tightening. By itself, if someone just comes in and has stretch marks, loose, lax skin after a pregnancy or some weight loss, we can tighten them up just with some thermage. But if they need shape and contour, we combine the liposculpture. The radio frequency heats the collagen support network of the skin, so we get a shrinking and tightening effect. We get some tightening pretty quickly.
So you're doing it at the same time, and is it 2 instruments under the skin?
Right afterwards. So I'll do the liposculpture part, and then immediately afterwards we'll go with the thermage, and it's applied directly to the skin. So they're done on the same day.
Does it help
at the
break
same
up the
visit.
fat by any chance, or even it out?
It does help give a smoother result because we get that shrinking and tightening of the skin, the collagen support network. We do heat the fat a little bit, but the main part is removing the fat for the shape and contour, and then going in and getting that tightening for them.
Okay, do you believe there's art to this, by the way? Because it seems like a straightforward procedure.
There's definitely art to it. The first is getting the patient's expectation. The next is marking the patient. So you look at their shape and contour and their proportions, and we're trying to take and maximize what they have and really contour them. Yes.
Okay, now you say you're changing people's lives.
We change people's lives.
They act differently after they get the procedure.
They do. Well, they act differently. They look differently. Their clothes fit.
So because
them
their self-esteem.
So they do. So you can take a look at a patient like this one here. On this patient, we look at the bra fold area here. This is a common area of complaint for women.
So on her back, that fold.
Now, most people will look at this and say this patient needs a tummy tuck. This is someone.
Do they say that? Do patients ever come in and say, "Doctor, I need a tummy tuck"?
Patients absolutely come in and say, "I've been told a tummy tuck is my only option. I don't want the scar. I can't have the downtime, the recovery time. What can you do for me?" So just with the lipo procedure, we can bring this up, give them a much better shape and contour.
When you look at this, by the way, on the console, do you say, wow, this is going to be a good result? Does that go through your mind?
Absolutely. It's really, it takes examining the patient, talking to them, examining. We try to show them to feel where their muscles are at, because that's really what we're doing. We're bringing out the shape and contour that's hiding underneath there. If they had shape and contour before, they're going to have it when we're done. Now look at the after. You can look at this area here.
Very nice.
Look how all this has come up. Look at this patient. We gave him a shape and contour. This person can wear their low-cut jeans.
Looks like they lost 35, 40 pounds.
They don't.
I mean, how far out is that after, by the way?
This is 6 weeks. So all our pictures are taken.
Nothing is touched up.
Nothing is touched up. All their patients pictures are taken about 6 weeks afterwards. This person can wear the low-cut jeans. They can wear that tight dress. They're going to have that shape and contour.
They're dressing differently? And
there's some people that when they come for their first visit, they tell us they've already been out shopping looking for new clothes because they can already see a difference that quickly.
How many sizes?
We tell them to wait until they get a little further out because they're still going to shrink down some more. So we don't want to buy in clothes until they've had a chance to shrink down.
What about dress sizes? Because when I look at this before and after, I mean, that's a huge difference.
That's a huge difference.
Okay.
So it can be 3, 4, 5 sizes.
But they're also losing weight. I mean, this person had to have lost some body fat as well.
They've lost body fat. They do lose some weight with the procedure, not as much as you would think, because everything's been focused. If someone goes and loses weight and they lose 10 pounds, they lose a little bit here, a little bit here, a little bit there. They've lost a little bit all over, and that's why they never really see that big of a difference. We've focused everything into these areas so that while they may lose some weight, it's really shape and contour that they've gained.
You say sometimes it gives people a second chance.
Absolutely. Well, it gives them a chance to get back the shape and contour that they had. I mean, things that they may have lost with pregnancy, lost with time. I had a patient the other day. She's like, I want to get this done because I want to go to the gym, but I won't go to the gym the way I look right now because I think everyone's going to be looking at me. So,
really?
Yeah. She's like, I want to get that shape and contour. I'm going to go and do the rest myself.
Do they eat better after this is done? Do you tell them?
Absolutely. We absolutely sit down and talk about with that portion there. And the motivation is there because they see what they look like afterwards. I've had people say, I want a picture because I'm going to put it above my treadmill. So every time I don't feel like working out, I'm going to look at that and say, I don't want to get back to where I was before. If they lose weight on top of the procedure, they're only going to get a better result.
Now, the critics could easily say, what's wrong with diet and exercise?
Diet and exercise is great, and many of the people that we see, I mean, that's what they've been through. They've been exercising. They're going to the gym a couple times a week. They're walking. They're running. They've went as far as they can go, and now they need some help. They need a boost. They need the shape and contour. Some of it's genetics, hereditary, that they would never get to that level on their own. So on this patient, we did the abdominal, upper and lower abdomens. We did the waist. We did this lower back, upper buttock area, got into the little bra fold, a little area here. And look at the rear view. Look at this this view here.
Same woman.
This is the same woman. You're going to see how we've marked out the areas. We've marked out into this little bra fold, the shape and contour, but the focus is really down here because we want to bring out and accent the curves that she already has. And you look at the picture here in the afterwards.
You gave her a waist.
So we gave her a waist. Like I said, she feels so much more comfortable. She can wear anything she wants, from low-cut jeans to a tight shirt that even shows a little bit of belly there if she wants to. So here's another patient, and we're gonna show you the back view. We're gonna look at these bra fold areas here. We're going to look at the waist. This is a patient that had 6 children, and she had really felt that she had lost the shape and contour. She was no longer comfortable wearing the tight-fitting clothing. She goes out to activities and things with her kids, and she doesn't feel comfortable. So on the front view, we can see that this area here, this is something that many people would look at and say, wow, that patient needs a tummy tuck.
Yeah.
She didn't want the scar. She didn't want the downtime and recovery time
because
she's out there.
But will her skin bounce back, though? I mean, with that big of a bulge?
Absolutely. The skin is very elastic. We're combining a tumescent procedure. This is someone that was done before we had thermal lipo. This is someone that we definitely would offer a thermal lipo now to try to get skin tightening. But you look at these areas here, you look at the waist, you look at the shape, you look at this bulge here. This is someone that wouldn't wear tight-fitting clothes. But now I want you to take a moment and look at the afters. I mean, look at this back area here.
Doesn't look like the same person.
Doesn't look like the same person. So, but it is. Absolutely. You look at the shape and contour, you look at these folds, these creases that used to be there, they're gone. So
how long does that take you to do, by the way?
The patients in the office.
Is this one time?
This is one session. We try to do as much as we can to be cost effective. We want to be safe for the patients also. We try to do this all in one procedure. And these pictures, like I said, are at about 6 weeks afterwards.
6 weeks, because it looks like, again, she lost 50 pounds. Doesn't look like the same person from behind or from the front.
So, well, that's the
buttocks is completely different. You didn't touch the buttocks on this?
Didn't touch the buttocks. We just taper into this upper area here to bring this contour change in here. The front, you can see the skin came up with the support from the garments they wear afterwards and the procedure itself. The skin's elastic. It is able to come up.
How soon can they go back to work? Somebody goes in on a Thursday,
Someone
Friday.
can have a Thursday procedure, Thursday, Friday. Monday, Tuesday, they can be back into a work type setting. It really depends on the individual patient. They can tell me more as to how they're going to do.
Do they ever, without your consent, go to work anyway?
Well, there are people that have been called into work. I had someone that worked at the border, and she got called in on an emergency the next day. She was working. I've had people do it. I really recommend you have a couple days. The patient can tell me more because they know how they feel, how they recover from things that they went through in life. And so they're going to be able to tell me when they're ready to go. It depends on how strenuous work they have to do also.
Okay, now we're going to take a quick break. We have time for probably 2 more before the break. So what are we looking at over there?
This is another patient here. This is an active person. She's actually in the military. She's just found that after having a couple children, she can't lose what she'd like to. I mean, she has good shape and contour hiding underneath there. It's just that you can't see it right now.
And this is the thermal lipo?
She had thermal lipo. She has some stretch marks, a little laxity in the skin there. This is 6 weeks afterwards. You can still see some of the marks that she was still wearing the garment to help support the skin.
She's got to be happy. It's an athletic look.
She's an athletic person, and now she has the look to go with it. Here's another patient. Once again, you look at the little bra fold area. We're going to taper up into that. We're going to give her a waist. This patient doesn't have shape or contour. She looks very blocky. We'll see patients that look like that after they've had a tummy tuck. They're super flat in the front, but they don't have shape. And
yeah, no waist at all.
No waist at all, and that's what we can really give them. And people look at this. Look at this after. Wow. I mean, look at that waistline. Everyone looks at that and says, you know, we've done something with the buttock area, but we really haven't. The folds, the creases are the same there. It's just that we've brought out that waistline that
it's very smooth, by the way, and these aren't touched up.
These are not touched up. Like I said,
I'm going to have to put results not typical on this. But is this typical? I mean, if you decide to go with a procedure, can you tell them the results in advance?
At the consult, we really try to determine what the results can be because it's really the muscles. So if someone has muscles hiding underneath there like that, absolutely we can give them that result.
Because this is an amazing result.
That's amazing. And the procedure really is amazing. If they had shape and contour before, we're going to bring back what they have.
What does she say? What does this woman say to you?
Oh, she's amazed. I mean, she came in with a whole new wardrobe. She's like, everyone at work is looking at me, asking me, what did I do?
Do they keep it a secret? Do they say, I'm just on a new program?
Yeah, you know, some do. Some just say, oh, you know, I've been working out and watching myself, and others are very honest.
So all their friends are killing themselves at the gym now.
Well, some are, but some are very proud of the work that we do.
Yeah.
And share with the, you know, they'll have people that come in and say, you know, I'm a friend of so-and-so, and I know what you did for them. You know, what can you do to help me?
We're going to take a quick break. We come back, more photos. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We are talking about therma lipo, and we are here with Dr. Nowak. We'll be right back.
Hi, I'm Dr. Eugene Nowak, founder of Nowak Aesthetics. Welcome to my office. Let Nowak Aesthetics show you what the most innovative procedures in dermatology, cosmetic surgery, and skin rejuvenation can do for you. Look younger, feel better, get curves in all the right places. At Nowak Aesthetics, we'll show you the way to a better you. Call for a free cosmetic consultation. 619-420-1840. Nowak Aesthetics. We're conveniently located in Eastlake. Let us help you be you.
Only better.
You're watching The Wellness Hour, leader in